Hi, I'm Cynthia. This is Sabertree Healing, and I'm here to help you heal and transform your reality. I'm so happy that you're ready to heal. Today, I want to talk to you about pelvic floor dysfunction. And this is a disorder in which men and women suffer quietly for many, many years, decades. And I know because I suffered from this myself. And as an acupuncturist, I researched and searched for answers. Not just alternative medicine, but Western medicine. In all ways I could, I tried to find ways to heal myself. Now I'm at a point where I haven't had any chronic pain, which before I used to have chronic pain for years, daily high pain. And now I don't have pain. Yes, sometimes I get a flare up, but I can manage it with these tools and techniques that I've learned. And one of the main techniques I want to share with you today, and that is pelvic floor breathing. With this breathing, you have control of your pain. You have a tool you can go to help decrease the pain on those crazy days. And if you keep using it, I feel it can help to relieve the pain completely. So let's get right into it. And I found that the easiest way to do this breathing technique is to visualize a bowl, a salad bowl in your pelvic floor area. A bowl that looks something like this. Right? So a salad bowl has a front side, it has side sides, a back side, and a hollow inside. So when I breathe, I visualize this bowl in my pelvic floor area. I'm going to draw it on my beautiful model here so that you get a better picture of what I'm talking about. Remember that your pelvic floor has a big job in the body. It's holding up all the organs in the core, your intestines, your bladder, your uterus. All of that is held up by your pelvic floor. So it's no wonder that your pelvic floor can get a lot of trauma, it can get injuries, weaknesses, tightnesses that all can cause a lot of pain and issues for you. This breathing can help with these things. So here we go, the salad bowl in your pelvic area. And then I like to picture a balloon, an upside down balloon sitting in this salad bowl. So here is the upside down balloon. This is the part where you breathe into the balloon. And remember, as a balloon, as you blow up a balloon, it expands from all angles. The bottom expands, the sides, just all around equal expansion with the balloon. So I picture that balloon inside the bowl. So there's the balloon upside down inside the bowl. And remember, with your breaths, when you breathe in, you're going to allow this expansion of the balloon in the pelvic floor area. You're actually going to feel the expansion forward, backwards towards your tailbone, on the bottom of the pelvic floor, right? So like if you sit in a chair, all the parts that touch, that's your pelvic floor. So you're going to feel it expanding on that bottom half also, and on the hips. I'm not talking about pushing and bearing down. You don't want to do that. You just want it to expand naturally with your breath. So when you breathe in, you feel your chest expand, you feel your belly expand. Well, now you want the breath to go deeper and lower to the pelvic floor area and cause expansion there. Many times when I was having a high level of pain day, when I would do these breaths, I would feel a trigger, like an increase, a spike in my pain as I would breathe. Now I know that don't be worried about this if it happens to you, because it just means things are moving. You're actually stretching the muscles, ligaments, the tendons. And this is so important because with your breath, you cause muscles, ligaments, tendons to expand, which then allows the blood, which carries healing properties, into the area. So if you have a hypertonic pelvic floor, meaning tight muscles in the pelvic floor, circulation is not getting where it's supposed to be getting. But with these breaths, it can start going there and start healing you. When I've had high level of pain, I have done these breaths 3 times a day, 10 breaths each time. So with each breath, I inhale, expand that balloon from all angles, and with the exhale, relax. Relax your muscles, allow the hips to widen, and cause relaxation with the exhale. With the inhale, think expanding the balloon, and the exhale, relaxing and deflating the balloon. So 3 times a day, 10 breaths each time, is what I would do when I was in high pain. Daily, morning, afternoon, and right before I went to sleep. This was key in getting me better. And now that I'm out of pain, I still do my breaths. No, I don't do them 3 times a day, but I do them often enough. Definitely daily. Another little trick I do is I lay my hands over my lower abdomen, just like that, on this area here. I lay them there so I could see my hands lifting with the breath, so that I know that the breath is doing what I want it to do. It's getting all the way to the pelvic floor area, not stopping at the chest or the belly. You want the breath to go all the way to the pelvic floor and cause expansion in that balloon. Remember your diaphragm, so this green part here is under your lungs. And when your lungs expand with air, it pushes down on the core organs and then pushes down on the pelvic floor muscles. This is good. It causes movement in the area, which can then cause healing for you. Doing these pelvic floor breaths combined with meditation is amazing for this dysfunction. So what I did is I would meditate for 20 minutes, also using these breaths. Not normal meditation breaths, but conscious pelvic floor breaths as I meditated. I recorded some videos on meditation that you could use and do these breaths along with it. I also created a meditation specifically for pelvic floor pain, and you can do that meditation using these breaths. I will link all of that in the description below so that you can try these breaths along with those meditations. This was key in healing my pelvic floor, and I want to share that with you so that you try it. Don't give up hope. There is a way to heal from this. I know that it's hard when you have a high level of pain to do this. To get started doing it is not easy. It's not easy to lie there and breathe into the pain when the pain is driving you nuts. But I'm telling you from experience that blocking that out and continuing to take action with the breath has really helped me so much. So when I had high level of pain, I would do these breathing exercises. And yes, at the moment it was not easy, but then the next day I felt relief, and the next day more relief. So just keep up with it, commit, decide, and take action towards your healing and transformation.